Welcome to video 5 in our comprehensive look at Zepbound and other GLP-1 medications. We've covered a lot of ground so far, and now it's time to talk about the cost of treatment and how you can save money. I'm Dr. Brian Hartman, a physician with the telehealth company Emerge. Let's start by discussing the cash price of Wegovy, Ozempic, Mounjaro, and Zepbound. I'm leaving off Saxenda because it's nearly impossible to find and may not be coming back. Wegovy, which is semaglutide in an auto-injector device approved for weight loss, is about $1,600 for a 1 month supply of 4 pens. The GoodRx discount can lower that to $1,388. There's a manufacturer discount coupon that can save $500 per box if you do not have coverage for it. Now you can hear a lot of this. Ozempic, which is semaglutide in a multi-dose pen approved for type 2 diabetes, is $1,150 cash price. GoodRx can drop your price to about $950. But since this is only approved for diabetes, it's likely the discount card can only be used if you have a diagnosis with diabetes, though the eligibility page doesn't say that specifically. The discount is for a maximum of $150 per month. Now, Mounjaro, which is tirzepatide in a single dose autoinjector device approved for the treatment of type 2 diabetes, is about $1,250 for a 1 month supply of 4 pens. GoodRx can lower that to about $1,050. And again, there's a discount program available, but you must have a diagnosis of type 2 diabetes in order to use it. The discount card can save you $573 if you don't have coverage for Mounjaro, or $150 if you do. Zepbound, which is identical to Mounjaro but approved for obesity, is about $1,250 as well, with GoodRx dropping the cash price to about $1,100. There is a discount card that can drop the price to $550 if you don't have insurance coverage, or $25 if you do. As of July 2023, the Mounjaro discount card required an ICD-10 code diagnosis of type 2 diabetes in order to fill it. And this led to many people doing whatever they could to be diagnosed with type 2 diabetes. This requires an A1C of 6.4 or higher, or a random glucose over 200, or two fasting glucose levels over 120. Don't try to get diagnosed with diabetes. This can significantly impact your insurance premiums and other issues moving forward. Let's do what we can to avoid the diagnosis of type 2 diabetes. Now, even Zepbound requires an ICD-10 diagnosis of diabetes in order to use the discount card. Now, these manufacturer discount cards are an interesting concept. Essentially, this is the manufacturer giving you money to buy their prescription. It's like they're standing at the pharmacy and handing the money to the clerk on your behalf. Now, because of this, patients enrolled in a government sponsored health plan such as Medicare, Medicaid, Champus, and TRICARE are not eligible for the discount program. And this is because of a ban on something called balance billing. Now, what is balance billing? Basically, it means you cannot be charged the balance if your insurance doesn't fully cover the billed fee from your doctor, hospital, pharmacy, or whomever. If I bill a patient $100, but Medicare only offers me $30, I can't then give the patient a bill for $70 for the remaining balance. Now, this is technically only for services covered by the government sponsored plan, but it does apply here. I'm not an attorney and I can't give you a full legal answer, but what I don't understand is why self pay patients can't use the discount card also. If you happen to know that answer, comment below and let us know. Now, if you're enjoying this video, please click the like button below and subscribe to our channel. It's hard work to produce these videos and edit them, and every view, like, and comment motivates me to make more of them. If you're looking for a telehealth physician, myself or my partners, Dr. Barb Carr and Dr. JJ Roberts, can help. Check us out at emerge4.me. Now, back to the cost of GLP medications. Why are these medications so expensive? Because they work really well. Medications are partially priced based on the cost savings they produce. The medical cost of untreated obesity and the result complications is not insignificant. The cost of bariatric surgery isn't either. But drug companies are limited on patent life and must recoup their profits in a specific time period. These profits reward shareholders for their investment, help research and development costs for the next drug, and unfortunately generate a fund to protect against the ever-growing pharmaceutical lawsuits. Interestingly, the patent for medications can include the delivery mechanism, which in this case is a pen. By patenting the pen, drug companies can extend the patent life on the medication. But remember the EpiPen fiasco? Epinephrine is not patent protected. It's been around forever. But the pen system was. And this led to massive price spikes from exclusivity and ultimately a federal lawsuit against the company who did it. It would be so helpful to patients, especially in these times of supply chain problems, if these manufacturers would produce the medicines in a multi-dose vial and we draw it up like insulin, or the compounded versions out there do now. But unfortunately, this cuts into their profit margins. Mounjaro is available in Canada in a vial form now in the last few months. How to save money. This is where we get away from standard of care and into the theoretical. Nothing I'm about to say is a recommendation, simply an observation and commentary on what others are doing. There is no magic way to obtain the pharmaceutical grade medication cheaper other than through insurance coverage or a discount card. But this is where the compounded medications come into play. Seems everyone is offering these peptides out of their clinic or coffee shop nowadays. Unlike some of the drugs on the market, GLP-1 medications are simple proteins that can be manufactured very easily. There's an FDA rule that allows compounding pharmacies to use FDA approved medications that are on a national shortage list in order to help them supply to patients in need. But they must change the formulation in some way, and most add a vitamin like B6 or something else. There's nothing special about the B6 component, but they can't just sell you the patented drug, so they add B6. Now, there are several different chemical formulas for semaglutide and tirzepatide. Only specific ones are FDA approved, though, and some pharmacies are selling the non approved version. You have to be careful and ensure that you're getting the proper version. Also, some companies are offering research grade versions that are not meant for use in humans. Now, this drives me crazy. How many people are doing bench research on rats or something else using these medications? No one. The company knows what people are doing with them, and it's blatant fraud and a way to get around the regulations. Now, compounded meds can be had for less than $200 a month and are an attractive price point, but again, you have to be careful that it's the FDA approved version and meant for use in humans. But also, make sure the person prescribing it is doing more to help you than just selling you a prescription. They should be discussing nutrition, exercise, lifestyle, and more with you, and they should meet with you on a regular basis. Splitting doses. There are some who transfer the medication from the autoinjector into a sterile vial and then drop a different dose using an insulin syringe. Now, this risks contamination and infection, as well as increases the risk of improper dosing, but it can save significant money. A 15 milligram pen could be used for 3 5 milligram doses. Maintenance. When in maintenance, you can save money if you extend the dosing interval versus keeping it the same and reducing your dose. Remember, these medications have longer half-lives, so you can extend up to 10 days and still have effective circulating dose of semaglutide or tirzepatide. Obviously, it depends on the person and the dose, but that's generally how it's done. And once you start getting beyond 14 days, it's probably time to drop down in dose and increase your frequency. Some patients take a 5 milligram injection once a month to help maintain their weight loss. But the important thing is working with your prescriber to come up with a plan that works for you, both financially and medically. I wish I had a magic solution for you. The good news is better medications are coming, which should drop the price on existing ones. Saxenda is coming off patent and should be available as generic soon. And remember, safety is important. I know many of you want to try these medications, but I caution you to do it in a safe way. Now, I hope you enjoyed this video. It is the last planned video on our GLP medication series, though I'll likely make further videos as the market changes. Now, what do you want to see in future videos? Comment below and let me know. Thank you to those who have signed up with me as a physician. I've enjoyed getting to know you and actually connecting faces to the other side of the screen of these videos. Now, let's get healthy together.